Now, a NICE technology appraisal has, in March this year, approved semaglutide for obesity management. And I want to explore how the drug can be supplied safely and appropriately through community pharmacy. So, first of all, Wegovy or Ozempic, does it matter?
And first, we need to unpick what Wegovy and Ozempic are. Well, they're both brand names for semaglutide, but the difference is what they're licensed for. So Ozempic is the brand name for semaglutide for type 2 diabetes, and Wegovy has a license for weight management. They're presented at slightly different concentrations and dose schedules, so there is a difference there. But for many people, the question will be, so what? And actually, in clinical practice, if a prescriber is prepared to prescribe Ozempic instead of Wegovy, and I'll talk about why that might be, for weight management, they will be prescribing off-label. So in other words, out with the license. Now, why would you prescribe Ozempic instead of Wegovy? Well, simply Wegovy is just not available in the UK yet. And of course, all the media awareness that had been generated that you talked about earlier has led to people wanting to get hold of semaglutide, and the only way you can do that in this country at the moment is as Ozempic, which is, as a reminder, licensed for type 2 diabetes but not weight management.
So could this result in supply problems? I mean, not enough Ozempic for people with type 2 diabetes?
It is a real problem. We're finding now that you can't get the lower entry doses of Ozempic. And in fact, I tried today and I couldn't get the high dose either. So it is in short supply, and the company have informed us that it's likely to be in short supply throughout the whole of this year. What that means is that for people that have been prescribed it for type 2 diabetes, they're not going to be able to get their medicine, and potentially an alternative is going to have to be found. So yes, it is an issue. There's also the question of professional indemnity and fully informing your patient of what you're prescribing. So for off-label use of medicines, which is not unusual, the prescriber and the pharmacist dispensing the medicine must ensure that the patient knows that it's being given to them off-label, and they understand what that means. But also, from an indemnity point of view, the prescriber must ensure that they're covered should anything go wrong.
Can we explore this a bit further? I mean, are the two drugs presented similarly? Do they look interchangeable to the user?
What's interesting, actually, and it's a bit of a, this is where somebody who's perhaps been involved in the trials of Wegovy, at the moment, it's not 2.4 milligrams of Ozempic. So Ozempic isn't available as 2.4 milligrams. So this is where you've got the difference in the dose and where the confusion can happen.
Oh.
If I go to the dosing of Wegovy, you start at 0.25, then you go up to 0.5, then you do 1 milligram, then you do 1.7 milligram, and then you do 2.4 milligram. And that's, you only reach 2.4 milligram by month 5. Whereas with Ozempic, we do 0.25 for a month, 0.5 for a month. Then you probably stick around that for months 3 and 4, but you could go up to 1 milligram in the 3rd month, and then it stops. So you can go beyond that, but you need your prescriber to then go beyond. But yeah, I think it's important to recognize that they have been, they have different licensed indications, so therefore they have a different dosing profile.
And next question, can semaglutide be supplied under a patient group direction, or must it always be prescribed?
Ozempic and Wegovy, when it's available in this country, so semaglutide, are prescription-only medicines. So legally, they should be prescribed by a appropriately licensed prescriber who has enough expertise to be competent to prescribe in this area. There is an alternative mechanism by which prescription-only medicines can be supplied, and that's under something called a patient group direction. And currently, Saxenda, which is liraglutide, which is the first of the GLP-1s to be available, can be prescribed under a patient group direction. And there are a number of community pharmacies that have this protocol. Essentially, a patient group direction is what it says. It's a protocol that, provided the individual in front of you, the patient, meets the requirements and there are no reasons why they can't have the medicine, then they can be supplied it. There's a number of governance, clinical governance, safeguards in place, but in that instance, the supplying pharmacist does not have to be a prescribing pharmacist. Now, if we come on to semaglutide, to my knowledge, there are no patient groups available for it because at the moment it's Ozempic. That's the only way we can get hold of it in this country. And Ozempic would be being used off-label, and that would be an inappropriate use of a patient group direction. So we'll have to wait to see if anyone develops a commercial patient group direction for Wegovy. But for the moment, it needs to be prescribed by an appropriately qualified and licensed prescriber who's prescribing within their scope of practice.